So this is what we didn't want to hear. And this is what I always deep down on the inside suspected, is that coronavirus was airborne. And some people already felt this way, and others weren't sure if it was true. So they kept dancing around the questions of how can this disease be transmitted. And so the CDC acknowledges COVID-19 can be transmitted through airborne particles. This is by Samantha Brodsky. And so whether or not the novel coronavirus, COVID, better known as COVID-19, is airborne, has been debated since the spring and garnered more attention in July after 239 experts signed an open letter arguing that the World Health Organization, which is known as the WHO in short, and other public health agencies have not properly recognized the possibility that humans can spread the virus through small droplets called aerosols. So the WHO had maintained that airborne transmission is risky only when aerosols are dispersed from infected patients during procedures in healthcare settings such as tracheal intubation and bronchoscopy. Then in July 9th, scientific briefing breaking down the modes of transmission of COVID-19. So the WHO acknowledged that the airborne transmission is possible in other cases, and the CDC only recently followed suit. So what scientists know about COVID-19 is starting to change. It's changing. Here's the lowdown on airborne transmission so far. So let me stop before I go any further. What exactly are aerosols? That's the question that is posed. Now that this is changing, just think of how many people have contracted this and how many people who didn't know this are now probably getting this because they're just not knowing how this can be caught. So for background, there's a difference between respiratory droplets that can travel briefly and sink to the ground, which the CDC and the WHO still acknowledge to be the main form of transmission, and tiny droplets called aerosols. And so when I think of aerosol, I'm thinking of something being sprayed out. So aerosols are a lot smaller than 5 micrometers and microns, or microns, and can float around for a while. It's like if you spray a spray and then that spray, it's a mist, and that aerosol is floating in the air, and you can walk right through it and get on your clothes, get on your face, and what have you. So Emily Landon, MD, Medical Director of Antimicrobial Stewardship and Infection Control at the University of Chicago Medicine, explained in an article for UC Chicago. Dr. Landon wrote the article back in March, only days after the national emergency was first declared in the U.S. due to the COVID-19 pandemic. But she explained the general distinction between aerosols and small bits of fluid that you can feel and see when someone is sneezing, which is what the CDC and the WHO typically refer to when they talk about droplet transmission. But aerosols are like hairspray in the room, she said. When you go into the bathroom later, it lingers. Furthermore, aerosols are airborne, and the larger droplets you can see when you cough or sneeze are not. And according to the New York Times, aerosols contain much less virus than the droplets do. The debate around the airborne transmission explained. So the experts who signed the open letter in July argue that studies do suggest COVID-19 can in fact be airborne and travel through aerosols from person to person when someone breathes, talks, sings, etc. And it's especially risky when people are indoors with poor ventilation. So just think about the reasons why they didn't want people indoors and inside of businesses, restaurants, theaters, nail shops, salons, because people socialize, they talk, they laugh, they get together, they pass each other, they use the restroom, there's public restrooms, they pass through there. So there's a lot of chance for transmission. And if you have a lot of people that are infected, how long will those small aerosols just constantly linger? Like in the restroom, in a common walk area where most people frequent. So if you just really consider all of that, yeah, that is pretty scary to think about. And now they're just now releasing this, which really I felt like I always knew that this was a possibility because it seems like they were slow to bring the information out. So the section on the airborne transmission in the WHO scientific briefing especially said that the WHO maintains its viewpoint on the main risk of airborne transmission being from medical procedures that generate aerosols. And Lou, MD, immunologist, infectious disease doctor with Stanford Healthcare, previously explained to Pop Sugar, which is the article where it's from, that these procedures could be, for instance, putting a tube down patients' throats to help them breathe. Procedures such as this could potentially make patients cough, gag, she said, and could generate more aerosols. However, the WHO also acknowledges the possibility of aerosol transmission through normal breathing and talking, as well as when respiratory droplets evaporate. So the scientific briefing states that people could therefore inhale aerosols and could become infected if the aerosols contain the virus in sufficient quantities. So we don't really know, but if you go to a place where it's highly frequented by different individuals, you don't know who all those people are who may be infected, and there's a lot of people who may not be wearing any protective masks. They're talking, they're socializing, and so there's more chance of you that could possibly get it, like subways, elevators, restaurants, bars, clubs, anywhere where people are indoors. So more research on how these viral aerosols need to be inhaled to cause infection is required. And also, like churches and schools, because you're going to be sitting there for a number of hours, minutes, time on end, and there's a lot of people that pass through those places. So timing of how long the aerosols last in the air has also been debated. A study in New England Journal of Medicine meant to mimic sneezes or coughs from humans suggested aerosols remain viable in the air for 3 hours. And so that right there should be enough for people to say, hey, we already kind of knew about this, but we kind of didn't know this part of it. So this seems like it's adding more on to what we already kind of know, some of us. So it says, a study from New England, timing on how these aerosols last in the air has also been debated. A study from New England Journal of Medicine meant to mimic the sneezes and coughs from humans suggested aerosols remain viable in the air for 3 hours. Though researchers told New York Times in response that aerosols could likely be suspended in the air for about 10 minutes to half the hour, as the aerosols wouldn't last a full 3 hours airborne in a setting outside of the lab. So the WHO reiterated that this is in its July 9 scientific briefing, stating that these findings were from experimentally induced aerosols that do not reflect normal human cough conditions. So the CDC recognizes that aerosols can last up to several hours in the air, which we'll explore ahead. So there is still a call for clearer public health guidance here, clearer public health guidance on airborne transmission. And a letter published by experts in science on October 5th asked exactly that. There is an urgent need to harmonize discussions about modes of the virus transmission across disciplines to ensure the most effective control strategies and to provide clear and consistent guidance on the public to the public, the letter states. And so what the CDC says about airborne transmission. So the CDC took months to address the possibility of airborne transmission. In September, published a guidance on its website acknowledging airborne transmission, only to take the language down. The CDC said it was posted in error. Now you remember that? And they said, oh, we made a mistake. We have to correct it. So this is what confuses people when they want to know how can you catch this. So as of October, though, the CDC maintains that the COVID-19 is the most frequent spread, though those large respiratory droplets released in a cough, sneeze, or breathe when in close contact with others. New guidelines do acknowledge the virus can sometimes be spread by airborne transmission. Some infections can be spread by exposure to the virus in small droplets, particles that can linger in the air for minutes to hours, the CDC notes. So they keep going back and forth, back and forth, back and forth. So these viruses may be able to infect people who are further than 6 feet. Now we're getting something else different. At first they say social distance 6 feet. Now they're saying this could possibly infect people that are further away than 6 feet from the person who is infected or after the person has even left the space. So the CDC points to the fact that the airborne transmission are more likely to occur within enclosed spaces with poor ventilation. Like what I said, places that many people frequent and we're indoors. Like we previously mentioned, additionally, heavy breathing can be a factor as well. Under these circumstances, scientists believe that the amount of infectious smaller droplets and particles produced by the people with COVID-19 became concentrated enough to spread the virus to other people, the guidelines read. So the people who were infected were in the same space during the same time shortly after the person with COVID-19 had left. The CDC further states in a scientific briefing that the data suggests COVID-19 does not spread through the airborne transmission at high rates. Okay, now they want to tone it down to say it's not at high rates. Like, for instance, measles does because experts would expect to have observed considerably more rapid global spread of infection in early 2020 at higher percentages of prior infection measured by sero surveys. Airborne transmission and super spreading events. So July's open letter from experts specifically states that airborne transmission is the only plausible explanation for what has been called a super spreading event. And so the clusters of people are infected with COVID-19. For instance, a single individual with that virus of COVID-19 infected a confirmed 32 people and 20 more probable others during a 2.5-hour choir practice. That's how fast that virus can travel and infect that many people that fast. And then those people, when they contract it, then they passed along. So in Washington State, this is what happened. A paper published by the CDC, which looked at clusters of COVID-19 in Japan, January to April, noted many clusters were associated with heavy breathing in close proximity, such as singing at karaoke parties, cheering at clubs, having conversations in bars, exercising in gymnasiums, or you can read about working out during COVID-19 here. So the size of the droplets in these scenarios is not clear, but those who had signed the open letter believe airborne transmission is likely the case in the super spreading events in general. That is the reason why they had closed down so many places and suggested that restaurants do outdoor dining, nail shops do outdoor nail services, unless the transmission, the numbers of people that are getting infected, that number starts to lessen, it goes down and it declines. Then they start gradually going back to some normalcy. However, if someone comes in contact with many people and they're infected and the surge starts again, then they start re-shutting everything down, which is what people don't want because our economy has suffered so much from this. And not only suffered from money loss, but from death of people and people not being able to work, and it has created havoc. So the size of the droplets, it says in scenarios, is not clear, but those who signed the open letter believe airborne transmission is likely the case in these super spreading events in general. So transmission, FAQ page also published on the WHO website in July. You can click on that and look it up. Acknowledges that there have been reported outbreaks of COVID-19 in some closed settings, restaurants, nightclubs, places of worship like churches, places of work where people may be shouting, talking, singing, schools. Kids are getting this. Babies are getting this. So in these outbreaks, aerosol transmissions, particularly in these indoor locations where there are long periods of time where others cannot be ruled out. However, the WHO scientific briefings makes clear that larger droplets, fomite transmission, contaminated surface, could also explain the clusters of cases, especially if masks were not worn, hands hygiene was not followed, physical distancing was not maintained. Okay, and so key prevention measures to take. There are factors that help protect us from the spread of this containing respiratory droplets, though. But for instance, airflow plays a part. So as we mentioned, the risk is highest in crowded indoor spaces, poor ventilation like churches, restaurants, clubs, gyms. Note, you should still wear a mask outdoors if you're near others. As Dr. Liu told Pop Sugar, so I hope that people understand that the longer you are indoors with other people, even if they're wearing cloth masks or surgical masks, the higher the risk of transmission becomes. So air circulation, she said, disperse respiratory droplets more effectively. Let's be clear, this doesn't mean that COVID-19 particles are just traveling through the air wherever you go. So how do we know that? From what we're hearing, because if many people frequent the area, we don't really know, right? We are assuming it could be anywhere because you don't know who just walked through there, how many people walked through there. So it could possibly be. So Bill Hanage, an epidemiologist at the Harvard T.H. Chan School of Public Health, clarified to New York Times, we have this notion that airborne transmission means droplets hanging in the air capable of affecting you many hours later, drifting down the streets through letters, boxes, finding their way into your homes everywhere. That, he said, is not the case. And so instead, we should be wary of being close range of people, especially indoors, especially when there is a lack of physical distancing happening in crowded places. The WHO recommends avoiding closed settings, crowded situations, and recommends optimal ventilation in indoor environments. This is echoed by the CDC. What's more, the WHO recommends physical distancing masks. We've heard that. The general public fabric mask suggests in areas of widespread transmission where physical distancing is not possible, medical masks, including N95 or N95 face masks, surgical face masks, the WHO says should be safe for healthcare workers, anyone with symptoms suggestive of COVID-19, people caring for those with COVID-19, and high-risk individuals when they cannot physically distance. So the CDC states that at this time there is no indication of a general community need to use special engineering controls, such as those required to protect against airborne transmission of infections like measles or tuberculosis in a healthcare setting. So what to remember moving forward: wearing masks when physical distancing cannot occur, especially when indoors. Cloth masks are recommended for the general public. Even cloth masks, if worn by everyone, can. We have this notion that airborne transmission means one aerosol, expert told New York Times. So avoid crowded places, especially indoors, where you can physically distance yourself from others. Super spreading events can occur when people are indoors for long periods of time with poor ventilation. Focus on ventilation. The expert's July open letter states that providing sufficient and effective ventilation supply, clean outdoor air minimizes recirculating air, like air conditions and what have you. So it's important, particularly in public buildings, workplaces, environments, schools, hospitals, healthcare facilities, and for older adults as well. Opening both doors, windows, they say can dramatically increase airflow rates in many buildings. So don't forget about other safety measures like washing your hands, stay home if you feel sick, if you're a person who is at higher risk of infection. So take appropriate precautions, call the doctor with any questions, and follow the guideline put in place where you live. So why did I read all of this? I know you're saying this is a lot to remember. Some of us already know. But do you know that, I don't know if you know this, but I don't always see people social distance. And since this thing has gone on for so long, I do see people wearing masks. I do see people trying, like, to, in some places, distance. It seems like when there's been like an outbreak somewhere, that's where you see people really taking precautions. But when things have quieted down and it's not an outbreak, people start to get relaxed and they start to fall back into their normal routines before the pandemic. And I noticed that happening a lot. Even not really knowing if it's safe and or not. And sometimes I don't really feel comfortable with that. I know some people still travel on airplanes. I heard that's dangerous because you're inside, you're closed up with people. You can't just socially distance necessarily. And it's air conditioned, I think recirculated air, I believe, I'm not sure. Um, then you have people still going to like night spots and bars and what have you, and I've heard that some people are having parties and doing things like they normally do, and they're not taking it serious. And then people get mad when you do take it serious. If they see you wearing a mask, they want you to take your mask off, which could potentially put you at risk if you're in a situation where you might be at high risk. So I don't know what you would make of this, but what I thought was alarming is that I feel like they go back and forth, the CDC. I feel like they want to tell us more, but they don't because they've been sort of, I don't know if they've been given a gag order or what, to not say too much. They slowly bring out information because I believe they don't want to create panic. But I feel at this point you can't create any more panic than it already has happened. A lot of people have contracted it. It's been more than 7 million. Um, And I don't think you can create any more panic than has already taken place. So what I would like is transparency, that they make clear and not go wavering back and forth on how you can get this stuff. This COVID-19. Be honest, be upfront, don't hide information from American people. I feel like that's what they did in the beginning. In the White House, there were leadership that were not uh, active in allowing the American people to mobilize and be prepared for what was coming. And it was far too little too late. And we were given bits and pieces of information, and now it's sort of being used as political weaponry. And it's sad because a lot of people have lost lives. People have gotten sick. They've lost jobs. The quality of life is altogether changed. I don't think it'll ever really be the same as it was before. And so, having said that, I'm going to let this video go, but this is not good at all. I feel like that more people are going to be sick because are infected because of not knowing vital information about the transmission of this disease. So I would say that it would be better that they give all of the information and be upfront and not hide anything, because you're talking about lives here. This is a life and death situation. This is not something that you wait and spring on people at the last minute. So, having said that, if you look at Donald Trump, he and his wife, several people that have been around him have now become infected. And now they're trying all these trial drugs to see if they'll work. And, I feel like we need to know what we're up against. We need to know, because a lot of people are afraid still, and they don't know if they're going to live through that, if they're going to die, because some people have died, not just some, many people have died. And more people are dying, and you have teachers dying, you have workers dying, you have parents dying, nurses, doctors dying, you have children that are getting ill. And I felt like they were hiding that. They were trying to make it seem like kids don't get it. In the beginning they were saying that, and that's very infuriating to say kids don't get it when now we know they can have it in their noses and their throats. You have babies that are fighting for their life with it. Even if they're able to withstand or shed some of the virus, who wants to have their kid get infected? I mean, to hide that kind of information, that is really wrong. But having said that, I'm going to let this video go. What do you think? This is really terrible. I think we have not been told the truth about a lot of things. And then some people are saying, oh, this is not real, this doesn't exist. Well, can you explain how all those people in New York died of this? So, and I still do believe, now this is my opinion, that this was some kind of weaponry. This right here, for it to alter the lives of Americans and people altogether, I feel like there was some bioengineering involved. I felt like this even early on, that, for it to spread this fast, that somehow somebody in the lab really screwed up, or they were angry, and maybe they, initiated some of this to happen, and they knew who it was going to hit. And then when other people got wind of it, they felt like this was going to be something they could use as political weaponry. And that's what's happening now. And so a lot of people are spent around because of this. So things are not the same. It has changed a lot of lives. It has ruined a lot of lives. Thanks for listening.